I'm so addicted to it. I mean, I play at least 4 or 5 times a week.
Dr. Jay Greenstein knows golf is about a whole lot more than a perfect swing.
The process of continuing to keep my hips flexible.
All summer long, he helps avid golfers better their performance and enjoy a more pain-free season.
We can improve their range of motion and flexibility, identify those biomechanical issues before an injury occurs.
Through Dr. Greenstein's combined experience as a chiropractor, physical therapist, and certified golf instructor, he analyzes a golfer's risk of injury based on how he or she currently plays the game.
We see a lot of elbow stuff and we see a lot of low back pain. It's very, very common. We see a fair amount of shoulder pain.
Derek Coburn says he learned the hard way. You can't overlook flexibility.
For somebody like myself who mostly spends time lifting weights and doing cardio, I don't work on my flexibility very much. By not doing it, I mean, that's certainly one of the main reasons why I was injured in the first place.
Greenstein also says many golfers need to focus on strengthening their core.
So if we can teach them to go through specific ranges of motion related to anterior front to back motion, anterior to posterior front to back motion, side to side lateral motion, circumduction, round and round in both directions, and firing their core, if they can control their core, their probability of having injury is greatly reduced.
When injuries do happen, Greenstein uses a combination of rehab and chiropractic techniques like spinal manipulation and something called the Greenstein technique to restore mobility and break up scar tissue.
If they early extend or they've got a reverse spine angle, which are golf pro terms for swing faults, and that causes a tremendous amount of irritation and inflammation. And over time what happens is scar tissue will surround those joints, muscles will tighten up to protect the area, and that limits the golfer's mobility. So what manipulation does is we get those joints moving appropriately again by actually creating some gaps, by creating some motion in those joints.
Helping his patients heal and get back to their favorite pastime.
Ready, steady, go!